this week's episode of Dynamic Diet on the Nigerian Television Operating Channel of Akure Dynamic Station. And from the studio here, we want to say Merry Christmas and Happy New Year in advance. I am Ni Omotense, but I'm not here alone this morning.
Hello beautiful people, it's good to have you join us today on Dynamic Diet on the Nigerian Television Authority. I am Folashade Famakiwa.
Well, this morning, let me greet you Merry Christmas once again.
I wish you the same, and everyone watching, I wish you a Merry Christmas in advance. So how are you preparing for this festive period?
And before we go into the program for today, I just want to say that tomorrow something's going to happen.
Yeah.
Wow. And that's going to be that is the event that will launch us properly into the Christmas mood here in Nta Akure. We're going to have our service of 9 lessons and carol by 1 p.m. tomorrow, and the venue is going to be the First Care Gospel Church. Well, on that note, let's welcome you once again to this morning's program, where we're going to have lots of things to discuss. For Lashadi, what are lines up like this morning?
Yes, we'll be looking at the promise kept for the universal health
coverage.
Yes.
Yeah.
So we've seen the clips, and afterwards we'll be going to the weekly mirror segment, in which we'll be mirroring the universal health coverage. How aware are people about this in Nigeria? This and many more will come your way.
The level of involvement and the level of access people are having to health services.
And of course, our entertainment segment, Adeni Adejigbe have a lot of interesting package for us on this segment.
And of course, the sports segment will not be left out, because lots of activities took place in the sporting world over the week and also the weekend. And we're still going to look at all of this.
Okay, so let's go and see a clip on the Universal Coverage Day, a promise that must be kept. Do stay with us, as we'll be right back after this time out. Stay with us.
You might have heard people talking about universal health coverage, but what does it really mean? Think about it this way. What do you need to get, be, and stay healthy? Can you Are there policies in place to ensure the services you need are available to you, your family, and your community, next time and every time? And does your government have accurate information about the whole system, so they can make the right decisions to keep everything working the way it should? Good health needs people, services, products, finance. Can make the right decisions to keep everything working the way it should. Good health needs people, services, products, finance. You might have heard people talking about universal health coverage, but what does it really mean? Think about it this way. What do you need to get, be, and stay healthy? Can you
And Joseph also went up from Galilee.
Come, let us sing praises to the King of Kings in carols.
Tell the story of his birth and the essence of his earthly ministry
As we read through the scriptures.
as the Nigerian Television Authority, Nta Akure,
In conjunction with First Care Gospel Church, Akure District and as its headquarters.
invites the general public to this year's edition of 9 Lessons in Carol service.
Date, Sunday 14th December 2025.
Theme: A New Dawn, Christ Our Hope is Born.
Time 1 p.m.
Venue: in Foursquare Gospel Church, 5-footer Southgate Road, Akure.
It promises to be a refreshing and soul-lifting experience. For inquiries, call
Femi 080-6721-9360.
Ekpebinu 090-366-90201. Merry Christmas and Happy New Year in advance from the management and staff of the Nigerian Television Authority, Nta Akure, the dynamic station.
Nta Akure. We are sending warm wishes from our house to yours. May this season be full of joy, peace, and laughter for you and your family. May this Christmas bring you the best gift you ever wished for. May this season remind you that joy isn't found, it's made, and may you find yourself surrounded by moments that remind you how loved you are. Wishing you a Merry Christmas and a Happy New Year from the management and staff of the Nigerian Television Authority, Nta Akure, the dynamic station.
And Joseph also went up from Galilee.
Come, let us sing praises to the King of Kings in carols.
Tell the story of his birth and the essence of his earthly ministry
As we read through the scriptures.
as the Nigerian Television Authority, Nta Akure,
In conjunction with Foursquare Gospel Church, Akure District and as its headquarters.
invites the general public to this year's edition of 9 Lessons in Carol Service.
Date, Sunday 14th December 2025.
Theme: A New Dawn, Christ Our Hope is Born.
Time 1 p.m.
Venue: in Foursquare Gospel Church, 5-footer Southgate Road, Akure.
It promises to be a refreshing and soul-lifting experience. For inquiries, call
Femi 080-6721-9360.
Ekpebinu 090-366-90201. Merry Christmas and Happy New Year in advance from the management and staff of the Nigerian Television Authority, Nta Akure, the dynamic station.
It's nice to know that you're still here with us on this program. Dynamic Diet on the Nigerian Television Authority Channel Akure Dynamic Station. This is the weekly mirror segment. Like we told you before we went on that short break, but we're going to look at the Universal Health Coverage Day, which took place yesterday. But, today we are going to at least look at what is that day all about and what are the things that we need to know. How are people actually accessing health, and is there a plan for health to at least be universal, especially in this part of the world? And that is why we have brought an expert in that field this morning, a man that is into health management, especially when it concerns health for all. My guest this morning is the Business Development and Client Relation Officer of the Ondo State Contributory Health Commission. My guest this morning is pharmacist Oluwafemi Kolawole. You're welcome to the program.
Good morning, presenter. Thank you for having me.
It's good to have you here, sir.
Thank you so much.
So we are looking at the investor health coverage, and I would like you to explain what it is all about and how critical it is to achieve this health for all.
Okay, so universal health coverage is the concept that has been adopted by the United Nations to the end that all residents can have access to quality health care when needed. And there are different aspects. Let me bring it down home. Well, the celebration started in the UN adopted it in 2012, 12th December 2012, and then it officially became the day in 2017. That's 12th December 2017. So how do we achieve this such that everybody, equity, such that it's not just the people that are financially buoyant that can have access to healthcare? Everybody, either you're vulnerable. In fact, our target at the let me bring it back to what we do at the Ondo State Contributory Health Commission, because that is the
no, but we're talking generally now. What the concept is all about?
Yes, I will narrate them.
So we want to ensure that everybody, either you're vulnerable, you do not have the financial means to access quality healthcare, that you're able to afford it. And we also want you to be able to have access to it. And that's that healthcare. We want it to be quality. So those are the three things. Access to quality healthcare that is affordable. Those are the three key things that we're looking at. So 12th December is the day that we celebrate it. We also use that day to, of course, create awareness about the concept. And we also use that day to get the political will of people, of government, of corporate organizations, to the end that they can look at how everybody. The understanding is that healthcare, it has been limited to only the rich. It's only the rich that are able to afford healthcare. But we are looking at how everybody, either you're poor, you're vulnerable, you do not have the means, you're retired, you're a student, you're a pregnant woman, you're a child under 5, how can you have this quality health care that is affordable?
No, you have talked about how can we have it, but let's bring it down now. How achievable is this?
Okay, so what the Nigerian government has done to achieve this, they've established the NHIA as the National Health Insurance Authority, that was commonly known as the NHIS before, and they've also established state health insurance agencies across all 36 states. So the State Health Insurance Agency for Ondo State is the Ondo State Contributory Health Commission. And that is the agency saddled with the responsibility to ensure that all residents of Ondo State have access to quality health care and that is affordable, without suffering financial hardship, without using the money that you're meant to use for the education of your children, without using the money that you're meant to use to get food for your family, without using that to access health care. A lot of people will want to use, the moment they know that if I go to the hospital, they are healed, they have the condition, but they know that if they go to the hospital, they will ask them to do so and so test, and they do not have the means to, the funds. So they rather say, okay, let me take care of my family and let me cope with that. And some of them even resort to using unorthodox herbal drugs that could even complicate or even bring more medical conditions into them. So what we have done at the Ondo State Contributory Health Commission is, to achieving that aim, is that we have come up with different health insurance products targeted at different, you remember I said the mandate is to ensure that all residents have access to quality health care. So all residents, either you are a citizen that is an indigenous of Ondo State or not, once you are residents, once you're residing in Ondo State, the Ondo State government, under the leadership of His Excellency Governor Loki Olumisan Idatiwa, has taken the health care of its citizens, has taken it really paramount. You know, the Ondo State government has the Our His agenda. The E there is for efficient health care and socio-economic welfare. So that is where we come into place, efficient health care. So to that end, we have different health insurance products that we have, come up with. There is the Abiyamo maternal and child health insurance scheme, but we like to refer to it as just Abiyamo. So that scheme is 100% funded by the state government. It's targeted at children under 5 and pregnant women in Ondo State. Vulnerable children under 5 and vulnerable pregnant women in Ondo State.
What define vulnerable pregnant women and vulnerable children?
So indigent clients, people that cannot afford the cost of healthcare. We have our way of, we also look at handicapped, disabled, those are the ways, and then we have our other ways of identifying them.
That was the reason why I asked that question, because will I just come into the hospital and you say, let me see your bank statement, let me see
to detect if you're vulnerable or not.
to determine if you're vulnerable or not.
So we have our criteria. So and then the entry points for Abiyamo, you would see by the time I go through all the schemes that everybody in Ondo State falls into one of those categories, and they can access health care, affordable health care. So Abiyamo's entry point is Card Igbeayo. Card Igbeayo is the Ondo State Resident Identification Card that is issued by SITA, the State Information Technology Agency. So once you get the Card Igbeayo that confirms that you are indeed a resident of Ondo State, you walk into our accredited facilities, that is hospitals for Abiyamo scheme. We have 9 of them across the 3 central districts of Ondo State. Now, Akure, we have Futa Teaching Hospital, former University of Medical Sciences Teaching Hospital, Akure. We have former Mother and Child, now State Specialist Hospital, Akure. In Ondo, we have Udimed Laje, we have State Specialist Hospital Ondo, like that in Ore, General Hospital Ore, and all of that. So once we have 9 facilities across board. In Ose, we have State Specialist Hospital Kare, such that there's a tertiary facility you can access that service in. So you walk into that facility with any of those facilities with your card Igbeayo that confirms that you're indeed residing in those states. We do not want it to be like we learned from the BA program, that is the one that was done by the former governor Olusegun Miko, where we had people that were not residing in those states come to enjoy.
You see, but of course, I knew somebody that time that just called somebody from as far as the north Kaduna State, please come and give birth in Ondo State. It's free here.
So how do they scrutinize this kind of people?
I think that's why this issue of Card Igbeayo is coming in.
Okay, so now when we talk about accessibility and affordability, does it mean that those who are vulnerable can just go and enjoy healthcare, and you who is not vulnerable, what percentage are you supposed to pay?
So
for any healthcare service?
What will answer this question is, let me go through the schemes.
Okay.
I think I spent a lot of time on Abiyamo. So you will see that there's a scheme for everybody, and even the people that are not vulnerable also have a scheme for themselves. So Abiyamo for vulnerable persons, once you show them the Card Igbeayo, they onboard you, they enroll you, and then you have access to antenatal delivery services, including CS. If there's a need to do CS, you have access to it at no cost. And then postnatal service up to 18 months of
after delivery.
Yes, after delivery. So you have access to that for you and the child. Then that is for Abiyamo. Then there is also the basic healthcare provision program. We have because we want to localize, domesticate the name. So we gave it the name Ilera Loro. BSCPP is confusing for some people, especially the local ones. So we gave it the name Ilera Loro scheme. So Ilera Loro scheme is co-funded by the federal government and the state government. 1% of the consolidated revenue fund from the federal government comes. I understand there are conversations towards making it 2% now, but at the moment it's still 1%. Then the state government also co-funds it. That is targeted for vulnerable population generally. Abiyamo is for vulnerable pregnant women and vulnerable children under 2. BACPP, Ilera Loro, is for vulnerable population. So you are handicapped, we have our indexes that we use to compute your vulnerability status. So that's one. You have access also to healthcare at no cost, 100% funded by that scheme. Abiamot is 100% funded by that scheme. But if you look at those two programs I've described, it's only for vulnerables. What about those that are not vulnerable, like you asked? So we came up with the Orange Health Insurance Scheme. That is oranges, and that is the name you see written on our. We picked the orange color because it's the color of Ondo State. So Orange Health Insurance Scheme, we have two parts. There is the one for formal sector, that is for civil servants and political office holders. We get our premium from their salary. Okay. So there is a percent of their salary that is across board, again in the spirit of equity. So 3% of the premium is what we take from the salary, is what we take as the premium. But that 3% is even co-funded by the state government. So the state government contributes 60% of that 3%, which is 1.2% of 3%. Okay, I'm speaking a lot of grammar. Let me bring it.
No. I'm anyway, for the sake of our viewers, that if you earn 100,000 naira, you are expected to contribute 3,000 naira.
Thank you.
Monthly or yearly?
Monthly. So out of your 3,000 naira, state government will give you 1,800. Then we remove 1,200 from your salary.
Thank you. So he has explained.
I think I'm a mathematician now.
Yes.
Yeah, you need to clap for it.
I think we need to appreciate our So that's exactly the calculations. We're earning 100,000. Your premium is 3,000 per month. The state government contributes 1,008, and you yourself contribute 1,002. So even the state government gives more than you're contributing. So it also means if you're earning 200,000, it's also the same 3%.
Now yours would now be 6,000.
Yes,
like which that would be like 3,600 and
2,004. In that same.
So do we say the higher you contribute to your health scheme, the better service you get? I know what I'm saying because I've experienced it before. There are some hospitals that give substandard medication. I can say it confidently because I experienced it. So how do you checkmate such hospital when you get paracetamol of a higher version and you are contributing something very or free? They give you something like water. So how do you checkmate such people?
So let me first state that health insurance scheme deal with generic products, drug products, not branded. How do I bring it home now?
Yes. If it's paracetamol, you are not looking at paracetamol produced by Niji or produced by Shadi. So it's paracetamol.
So we are not looking for Panadol. Okay. We are looking for the active pharmaceutical ingredient, which is paracetamol. That is what health insurance schemes do generally, and there is no. The service, the access to service is the same across board. So what a civil servant contributing 3,000 would get, the quality of service a civil servant contributing 3,000 would get is the same quality of service that the governor, our political office holders contributing, of course, the 3% of their own salaries will be more, is the same quality of service across board. Now, if we have any facility, any of our accredited facilities that we find not delivering the quality of service we expect of them. Now, we have different mechanisms of addressing that. We have our 24-hour contact center numbers that clients can call to get across to us directly if they experience any of those
things. That's why you are here, to let them know the number.
Before the end of the program, I'll share the picture with you so that it can be displayed to our viewers and our viewers can see it. It's 24. There is the 24-hour contact call center number. There's also the 24-hour WhatsApp number that they can chat us on.
In case of any challenge.
Yes, and they can reach us. We also have whom we refer to as third-party administrators, TPAs. These people are like intermediaries. Other health insurance agencies call them HMOs. So they are like intermediaries between us and the hospital and the clients. So they can also call those HMOs. And if we find that to be true, we have our internal mechanisms of sanctioning them. We can suspend and we can even delist them in for repeat offenders.
Thank you very much, Pharmacist Kolawole. You've spoken very much well. But let's not look at it holistically. You know, you're talking more about your activities. But let's look at generally access to health, because that is even more paramount, because that's why we're here. We are celebrating the Universal Health Coverage Day. We are not talking about your agency, except you want to pay me. which I'm going to do collect that for my station, because we run with diesel and everything. Now we're talking about access. We are in a part of the world where data collection, database is a problem. How do we get everybody involved and still able to give quality service?
Healthcare, to achieve health for all, it has to be a multidisciplinary approach. Everybody have to come into the picture. The pharmacist, the doctor, the medical lab scientist, the statistician, the health information manager in the hospital, everybody has to come on board to get this data that we need. These are the things that we can use to check. Again, I will use the example of the ODCSC. Every month we get 2 data from our health facilities that we use to access to check if clients are actually accessing those services. What are the most utilized services? What are the services that clients are coming to access more? So it is this data that we can use to now improve. Okay, what are we not doing well? Where are we lagging behind in supply of services to these enrollees? That is how we can checkmate it. I also want to state that primary health care is the way to go. Primary health care, because we have to localize health care. We have to get to the roots such that people in the villages can have access, and that is why I will keep citing HODCSC. We have accredited primary health centers across the 203 wards of Ondo State, such that people in those communities can access health care. Now, if they now need a secondary health service, they can now refer them to a secondary facility in a more urban place. So there is this Amahata Declaration in 1978 that talks about health for all, and the fact that the major way to achieve health for all is primary health care.
Because I asked that question, I'm sorry. I asked that question from my observation, where I discovered that the population that is accessing this, either at the NHIA level or whatever state, whatever, it's like compared to
those in
our
the
population, actually, I think it's significantly too low. So that's why I was asking, how do we ensure that everybody is brought in?
Then,
there are people in the people in the formal sector. It's easy to get them. There are people in the informal sector, and who may not even understand all the grammar we're speaking.
No, the thing is, they need that information. So they like in Lagos State,
about information
in Lagos State, there for families to have access to this insurance, it's just 10,000 naira annually. So do you tell me that they cannot afford it? They can, but they need information, the right places to be. And there are some African countries that are already doing this universal coverage thing, in which they have ambulances in communities that don't have good roads and all that. Maybe a woman wants to put to bed, that ambulance is well equipped. So how accessible, how soon can Nigeria afford this kind of service, that you don't need to go to a general hospital in Akure and Owo and all that before you'll be able to access it?
You know, you didn't allow me to hit the point I was going to. I was going to enter into the informal sector that you mentioned, because we have a scheme for them. And in Ondo State, they pay as low as 18,000 naira. Again, information. One of the ways that they can know is through continuous sensitization, which is one of the things the Ondo State Contributors Commission. When you were introducing me the other time, you mentioned that I'm a business development and client relations officer. So one of my fundamental role is to pass this information across.
Pharmacist is like, I'm going to charge you the more you advertise on this program.
So how can we get them to know about this? continuous sensitization, and that is one of the things that universal health coverage is for. Is to let people know that they can have access to quality health care, even at the primary health level. Nigeria would have to practice what we refer to as community health. It does not necessarily have to be a doctor, because of the whole brain drain thing, Japa syndrome. Health workers are leaving the country en masse, even though those state government and the federal government are doing so much to encourage them to stay and to also employ them. However, be that as it may, if you can get a nurse, either retired, either stay active, that is attached to a community, the nurse is more like the person responsible for the health of all the persons in that community.
Under his or her jurisdiction.
Exactly. So the nurse, in fact, it's more community health is more community based. So you don't spend
volunteers and all
thank
that.
you. You spend less time in the clinic. You spend more time in the community.
Yes.
You can, as a community health
preventive
worker, yes, you can tell them what to do. If you notice that the water source there is poor, you can liaise with the local government chairman of that area to ensure that they can get them adequate water source, so that they don't come down with waterborne diseases, cholera, diarrhea, dysentery, and all that. So primary health care is the way to go, and the Ondo state government keeps doing so much to that end. So we also need to reorientate, let me use that word, our viewers, that they do not believe that only a doctor can attend, because a lot of them, one of the reasons you mentioned the utilization in primary health centers, that the figure is low, even though you didn't quote your source, your data source. But one of the things that might be responsible for that is the fact that a lot of people do not believe if they are not seeing a doctor. These people have been trained, the community health workers have been trained to give you primary service. They know when to identify a case where they need to refer and say, okay, come to this secondary facility. It's beyond, they will refer you.
The facility we have, the expertise and everything.
Yeah.
Let's refer you to a higher
And one
place.
of their responsibilities is even to help you know the structure of how to get you across to the secondary facility. So it's not just telling you, I referred you, go to Unimed Laji, maybe you're in Ileoluji, and then the person says, okay, go to Unimed Laji to access healthcare. And of course, most of them, probably because of finances, they won't
even go. It's like once some people hear referral, they believe how delayed that is.
Which is not true.
They cannot even handle it again. They are sending me to.
Which is not true. So yeah, that's the way to go to ensure that everybody, this universal health coverage goal, we can achieve it. And you can't take health insurance away from universal health coverage. In fact, that's the key thing to achieving universal health coverage in this health financing. If people cannot afford health care, they won't get it. They won't go to the hospital. And if they don't go to the hospital, universal health coverage goal will not be achieved, because they will keep dying of simple diseases and all of that.
Well, thank you very much, Pharmacist Oluwafemi Kolawole, for being my guest this morning, the Business Development and the Client Relation Officer of the Ondo State Contributory Health Commission.
Thank you, sir.
Well, before we leave this program today, what will be your final word?
My final word for our viewers is this universal health coverage goal is achievable. You have to be responsible. You have to first be responsible for your health. You can't have an environment that is dirty. You can't have stagnant water in your environment and expect that you won't come down with malaria and other diseases that can breed, that can lead to. So everybody has to be involved. You can't defecate, practice open defecation, and those are the little things that leads to this thing. So you have to first be primarily responsible for your health. And another way, like I talked about, that can make you get access to health, that can make us get to that universal health coverage goal, is health financing, health insurance. Purchase a health insurance plan for yourself if you are not in the formal sector. Get a health insurance plan such that when you need to access health care, it's easy for you, it's affordable, you're not paying a dime after the initial premium you've paid. So that's my message for you.
Thank you so very much for being on the show, sir. So the program continues shortly with our entertainment segment packaged by Adeni Yadejuibe. Do stay with us.